How is Duodopa infused using a PEG-J tube? Imagine a way to keep Parkinson's symptoms steady throughout the day by delivering medication directly into the small intestine. That's what Duodopa infusion does using a PEG-J tube. This method involves placing a special tube that allows continuous delivery of levodopa and carbidopa gel, helping reduce the motor fluctuations that often happen in advanced Parkinson's disease. The process begins with inserting a PEG-J tube through a minor surgical procedure. First, a PEG tube is placed into the stomach using endoscopy or fluoroscopy, which involves guiding a thin tube through the mouth or nose into the stomach. This procedure is usually done under sedation to keep the patient comfortable. Once the PEG tube is in place, a smaller, flexible J tube is threaded through it and advanced into the jejunum, which is part of the small intestine. This setup allows the medication to bypass the stomach, leading to better absorption and more stable symptom control. After the tube is correctly positioned, it is connected to a portable pump designed specifically for duodopa therapy. This pump is programmed to deliver a precise amount of medication in 3 ways. First, it provides a large dose in the morning to quickly achieve an optimal on state. Then, it continuously infuses medication throughout the day to maintain steady symptom control. Finally, it allows 4 extra doses if unexpected, off periods occur, helping manage sudden symptom worsening. Proper care of the PEG-J tube is vital for safety and effectiveness. The area where the tube exits the abdomen should be cleaned daily to prevent infection. The jejunal tube needs to be flushed with water every day to prevent blockages, and the gastric tube should be flushed twice weekly. Only water and duodopa gel should be used through the tube to avoid clogging or damage. If the tube becomes dislodged or damaged, medical help is needed to replace or reposition it properly. The placement procedure is typically done under sedation, with the help of endoscopy or fluoroscopy to ensure the tube is correctly positioned in the jejunum. After insertion, an X-ray confirms the placement. While generally safe, the procedure carries some risks related to the invasive nature of tube placement and the patient's health status, which should be discussed with the healthcare team beforehand. In summary, using a PEG-J tube for duodopa infusion offers a continuous, targeted way to deliver medication directly into the small intestine. This approach helps provide more consistent symptom control, improves quality of life, and is especially useful for those with advanced Parkinson's disease. Proper insertion, careful pump programming, and diligent tube care are essential to ensure the therapy works safely and effectively. Always consult healthcare professionals for personalized advice and management of this advanced treatment option.